Ketostix measure the amount of ketones in your urine. A ketone is a substance which is not usually harmful when found in small amounts in the urine. The amounts found in our urine can give us information on carbohydrate and fat metabolism. Patients who commonly test for ketones are dieting patients, pregnant patients, or diabetics. For healthy patients, this tool can be used to determine if the body is in fact burning fats. For example, patients on an Atkins diet or ketogenic diets consume less carbohydrates so that they switch their body's metabolism from metabolizing glucose as energy to converting stored body fat into energy. This process is called ketosis and begins when insulin levels are low. Typically, patients on low-carb diets will only see small amounts of ketones versus those that are diabetic patients. For patients that have diabetes, Ketostix are useful in preventing possible fatal situations. Diabetic patients can use these to determine if they are at risk for ketoacidosis. There are times when diabetic patients could be burning too much fat and producing too many ketones. Typically, these are in times of stress, illness, infection, and during pregnancy. This can develop into diabetic ketoacidosis that can lead to a coma. When high levels of ketones are seen in diabetic patients, immediate actions need to be taken. Contact your doctor as soon as possible so that they can help determine what medication changes or regimens need to be made. Ketostix should be used when blood sugar tests are higher than 240 milligrams per deciliter for 2 or more tests in a row. If you feel as though your blood sugar is high, if you think that you have an infection, or if you are ill, stressed, or pregnant. Now we are going to discuss how to use the Ketostix. First, you want to check to see if the Ketostix are expired. Be sure that they're not expired because this can alter your test results. Also, make sure that your test strips are not opened within the last 6 months. A good practice would be to write down the date on the open bottle on the outside of the Ketostix bottle. Now, what you want to do is collect a fresh urine sample in a clean and dry container. Remove one strip from the bottle and replace the cap tightly. Be sure to do this so that you do not contaminate the test strips and to keep the test strips dry. Dip the end of the test strip into the urine sample. Now you want to remove the test strip from the urine, but be sure to do this by sliding the strip on the rim of the container to remove the excess urine. Wait exactly 15 seconds. And compare the color on the strip with the color chart located on the bottle. A light tan color represents negative results for ketones, and the burgundy color represents a large amount of ketones in the urine. Also, there's some things that you want to make sure you do not do. Do not touch the test area portion of the strip or allow it to touch any surfaces. Do not dip the test strip into the toilet after urination, but instead use a clean, dry container to collect your urine sample. Do not store the strips near moisture, direct sunlight, or heat, and also do not remove the white desiccant packet from the bottle. You also want to make sure that you do not use expired strips, or use strips from a bottle that's been opened more than 6 months ago. Bayer strips tend to be recommended above all other brands because they do not expire quickly. Also, do not use discolored test strips. Ensure that you record all Ketostix results to show your doctor at your next appointment. If you are a diabetic, presence of moderate or large amount of ketones in your urine should be reported to your doctor right away so that immediate action can be taken. Now let's review a little bit about what we just talked about. Ketostix are used by diabetic, pregnant, and dieting patients to measure the amount of ketones in the urine. Remember to check the expiration date before use and store your Ketostix in a cool, dry place. Also, it is important to check the color of the Ketostix exactly 15 seconds after contact with urine. Then compare the Ketostix to the color chart provided on the bottle. If the color has changed to a dark or deep purple, please contact your healthcare provider immediately.